My name is Dr. Chudi, the convener of Snowspiration's Global Health Solutions. And today we'll talk about sexually transmitted diseases. So, what are sexually transmitted diseases? Sexually transmitted diseases are those specific diseases you can only contract during sex. That's the simplest way to define sexually transmitted diseases. Now, it's very important you understand the difference between a couple of other diseases that can affect your sexual organs. So, there are a couple of disease conditions that can affect the sexual organs that might not be necessarily classified as STDs. An example is candida infection. So, candida infection, it's a type of disease that can affect the vagina. It can affect the anal region. It can also affect the oral part of your body. When you have candidiasis, most people tend to think, oh, they got it through sex. But in reality, candidiasis, it's not a type of sexually transmitted disease. So there are other means you can pick candidiasis, which is not through sex. So whenever you hear sexually transmitted diseases, you have to think about those diseases you get when you engage in sex. So you see, the diverse population of people actually shows the different methods of sexual interest. So people can have anal sex, people can have vaginal sex, and people can have oral sex. So sexually transmitted diseases are those diseases you can pick when you engage in anal sex, when you engage in oral sex, or when you engage in vaginal sex. So these three different routes of having sex can be a portal to picking sexually transmitted infections or diseases. Very important. Now, you might begin to wonder why sexually transmitted infections is actually common. The reason is not far fetched. In life, when you know better about a disease condition, you'll be in a better position to pinpoint when you have the symptoms. So, lately, people are not really conversant, people are not aware of the signs and symptoms of these sexually transmitted diseases. And unfortunately, majority of these sexually transmitted diseases will present with vague or no symptoms at all. So if there is no active surveillance, active being on lookout for these infections, if you don't go out seeking for them, if you don't go to your doctor, probably we collect your blood sample, probably we collect your urine, or probably we collect any other body fluid to check and see if you have the sexually transmitted infections. You might likely have it in your body, but because it's not giving you any signs, because it's not giving you any symptoms, you might be a carrier of the sexually transmitted infections. So when you hear about sexually transmitted infections, what comes to your mind? There are different classifications of sexually transmitted diseases. So it can be bacteria in origin. So an example of bacteria sexually transmitted disease is chlamydia or gonorrhea. It can also be viral. An example of virally transmitted disease is HIV, human immunovirus. You can also have herpes infection. You can also have trichomonas infection. You can also have syphilis. So there are different classifications of sexually transmitted diseases. So it's very important it's properly diagnosed and properly classified. Let me give you an example. If you have a bacterial infection and it's not properly classified, because virtually all sexually transmitted infections can present with the same and similar symptoms. Majority of them in women will present with vaginal discharge. Majority of them might present with spotting, with abnormal bleeding, with itching, with pain during urination, with pain during sex. Guess what? Viral sexually transmitted disease can present with that. Bacterial sexually transmitted disease can present with that. So if you don't classify them, when you go about treating them just as a layman, you might end up doing the wrong things. You might end up abusing the medications you're taking, because if you have bacterial infection and you end up taking antiviral agent to treat something like gonorrhea, guess what you're going to do? You will end up complicating things. So it's important you go through the route. It's important you educate yourself and you know the basic symptoms of each sexually transmitted infections. Now I'm going to take time to give you the very important and common sexually transmitted infections which are very significant in women's health. So the first on the list I've already mentioned: chlamydia, trachomatis, gonorrhea, syphilis, HPV. HPV stands for human papillomavirus. Very important sexually transmitted infections. Why? Because this particular viral infection, this particular viral disease can actually lead to cancer of the cervix. And the good thing about sexually transmitted infections is the fact that it can be 100% prevented when you know what to do, because when you avoid sex or when you indulge in sex responsibly, the only thing that can save you to an extent from picking sexually transmitted infections is the use of barrier method of contraception, of which condom is number one. But the only guaranteed way of avoiding sexually transmitted infections is complete abstinence. If you don't engage, you won't pick it up. But here's the deal: if you've engaged in sexual contact in the past, it can be 20 years, it can be 30 years, or if you're currently engaging in sexual intercourse, or if you're planning to engage in sexual intercourse, there are so many things you need to be conversant with. So you might likely look okay right now, but you might have a chronic sexually transmitted infections currently in your body without knowing. Two important ones we're interested in are the chlamydia and the gonorrhea, because both of them can graduate from being acute. So we have two different ways of classifying disease conditions. It can be acute if it's just something that is currently going on, or it can be chronic if it's gone beyond 6 months. So some people might pick gonorrhea. Over time, that gonorrhea wasn't treated. So it's in your body causing a lot of damages. Matter of fact, they love the tubes. So it can go to your tubes, it will be in your tubes, damaging your tubes. In the same vein, you can pick chlamydia. You will think it's gone, but it's still in your body on a chronic level, damaging your tubes, leading to what we call pelvic inflammatory disease, which over time will be a detrimental factor when you want to start having a baby, because it will lead to blockage of your tubes, or it will lead to adhesions. And when your tubes are not open, the possibility of becoming pregnant through the natural means will be affected. So sexually transmitted infections can be deadly. Most times people focus on the ones the cultural, stigma around it seems to be much. Like people, when they hear about HIV, they start freaking out. Viral infection like HPV, it's more deadly than HIV, because if you know what to do to prevent HPV, like HPV has a vaccine. Anytime you have any disease that has a vaccine, that's a huge advantage, because if you take the vaccine, you would have prevented the disease from happening. So I just wanted to summarize by telling you that sexually transmitted diseases, it's important in women's health. So it's important you know in details. In subsequent lectures, I will teach you guys on individual sexually transmitted infections. Thank you for coming, and bye bye for now. Bye.